As a pediatric nurse practitioner, I've been working with childhood immunizations all of my career. And after reviewing the World Health Organization information, I see the great importance it has for adults as well. Vaccinations have been estimated to have reduced about 6 million deaths worldwide. And in the U.S. alone, since vaccines have been used widely, we've got about a 99% reduction in 9 childhood illnesses. The influenza vaccine is recommended for almost everyone to be received every year. The vaccine does change yearly because they look at the kind of illness that they're predicting for the year. So it's recommended for children over 6 months all the way up to elderly. It's been shown not only does influenza vaccine help prevent influenza, but it also decreases heart disease and strokes in elderly. Prevnar vaccine was started in 2000 and routinely given for children, and it prevents streptococcal pneumoniae, which is pneumonia. The great thing that we've seen since the beginning of the Prevnar vaccine is that we've had a great reduction in pneumonia in adults. Translated into grandparents and parents and people that are loving and holding those babies. We've decreased the number of pneumonia cases in children, and that has decreased the pneumonia cases in adults. The World Health Organization has estimated about 12,000 fewer deaths in adults because of the Prevnar vaccine. Because children are vaccinated, then the adults are safer. Vaccines are very safe. In fact, they are safer than therapeutic medications that we give. So when we think about taking a medication for an ear infection for a child, that medication may cause more harm than a vaccine would cause. And yet our perception of the vaccines is skewed, and there's a lot of misinformation about how they can be dangerous. They are very safe and they are very protective. Look at smallpox being eradicated. That's the main illness we've seen that's been eradicated by vaccine. But we can get there with other illnesses if we keep our vaccination rate up. We've had a recent measles outbreak throughout the United States. I heard today that there were new cases in Chicago. There have been a few cases in South Dakota, and that's a really interesting situation. If immunized for measles, we really do not see cases. Now, some children cannot be vaccinated. If you're under a year, it's too young to have that particular vaccine. There are many others that are safe, but it's not recommended for under a year, the measles vaccine. So if you're under a year, you're at risk to get measles if you're exposed. Now, if the rest of the population that can be immunized gets that vaccine, it's protecting the child who is too young. There are other instances where we can protect others by being immunized. If someone has an illness like leukemia that they cannot have a vaccine, they're protected if everyone else that is asked to get that vaccine gets it. Elderly people who are at declining health and may be at higher risk, people with cancers, they are higher risk for getting an illness, and we can protect them. The general population can protect them by getting the immunizations at the proper time. Autism is not related to vaccinations. We don't know the cause of autism, and that's where part of the problem lies. People want to find a cause. Granted, that would be great if we can help children and help families if we can find the cause. But there was a study done many years ago that linked autism with vaccines, and it's been proven that that study was incorrect. And there have been multiple studies since then. Each one has proven that there's not a link. Unfortunately, we're still looking at the first study that erroneously said there was. If you look at the data, it's very easy to say vaccines are safe and do not cause autism. Children may have a low-grade fever after an immunization. They may have a little bit of a sore arm or thigh after an immunization. Those are minor in comparison to getting the illness. There are many deaths caused by measles, for instance. There are deaths caused by chickenpox, and we now have a chickenpox vaccine. Those of us who lived through those illnesses, I'm a chickenpox and measles survivor. I went through them fairly easily, but not everyone does. So if we can prevent the illness, let's do it. It's much safer to take the vaccine than it is to get the illness. It's really been proven that the decrease in death rate and decrease in illness rate, morbidity and mortality, are reduced because of vaccines. And that translates to a lower cost for society by protecting the individual and not having the further cost of the illness. The cost of a vaccine is so much less than the cost of a hospitalization if a child or an adult needs to be hospitalized, but it also can be looked at as a savings with parents who may need to work and they're not home with their child for that week or longer when their child is ill from an illness that could have been prevented.